Hi everyone, my name is Stacy Christensen and I did my presentation on Pseudomonas aeruginosa. So this bacteria normally grows in moist environments, usually in hospitals or nursing homes. So some common examples where you might find this bacteria would be soil, water, hospital equipment, IV fluids, cleaning solutions, even plants, physical therapy pools. So it can actually occasionally be present in the armpit and also anogenital regions of humans, but not quite as common. So as the name indicates, it's a member of the genus Pseudomonas. It's a gram-negative rod. It is encapsulated, and it's often classified as aerobic, meaning it requires oxygen to grow, but it is actually able to grow anaerobically if certain substrates are present. And it moves around by a flagellum, and this is what gives it fast-moving qualities. So this bacteria has many different virulence factors. I've listed a bunch of them. On the next slide, I'll go over a couple more in detail. But basically, they help facilitate adhesion to the epithelium of the host. They'll disrupt host cell signaling pathways. They'll damage the tissues of the epithelium, or specifically the epithelium of the tissues. And they'll even evade certain immune responses. So expression and release of these factors is regulated by what's called quorum sensing molecules. So here are some more virulence factors in detail. Lipopolysaccharides are the main component of the outer membrane of the bacteria, and they basically help maintain structural integrity, protect the outer membrane from certain chemicals, and they're also involved in activation of the host cell's innate and adaptive immune response, and this can eventually lead to uncontrolled inflammation response that can possibly kill the host. So they also have a certain type of pili, which is to allow the bacteria to adhere to various cell types. They also have what's called a biofilm, which forms when the bacteria stick to surfaces in moist environments and then begin to reproduce. And this also helps the bacteria adhere to surfaces. So they have different secretion systems. This one is a type 3 secretion system. Basically, it helps take proteins from the cytoplasm of the bacteria and deliver it to the cytosol of the host. This secretion system will also help the bacteria evade phagocytosis, and it will even help damage the tissues of the host. And then lastly, there's something called exotoxin A, which is just a very potent toxin, and it secretes certain proteins into the host's extracellular environment. And then this one also causes tissue damage and then even tissue death. So this bacteria is referred to as a nosocomial pathogen, meaning it primarily occurs in hospitals, especially in the intensive care units. And then it's also an opportunistic pathogen because it takes advantage of individuals with weakened immune systems in order to initiate the infection. However, it rarely affects healthy individuals. So it's commonly seen in people with neutropenia, which is just a really low amount of neutrophils, which are a type of white blood cell. It's also commonly seen in those who are immunocompromised. Transmission occurs basically through contact with contaminated water, hands, objects, surfaces, or equipment. So Pseudomonas aeruginosa can cause many different types of infections. Here are some of the common kind of classifications of infections that it might cause. So skin and soft tissue infections, respiratory tract infections, urinary tract infections, and then very rarely acute bacterial endocarditis, which is inflammation of the endocardium of the heart. So I've listed some signs and symptoms affecting just various areas of the body. Basically, it's what you would expect with inflammation, so pain, redness, swelling, certain areas will get either a discharge, or in the case of wounds, they'll get a characteristic kind of greenish colored pus or discharge that even has sort of a fruity smell. In very serious cases, they might develop septicemia, which is infection of the bloodstream, which can be very dangerous. So in order to diagnose, doctors might order various studies. I've listed some of these, so complete blood count, a lot of different cultures, so either blood cultures, or if they suspect something in the respiratory system, they might do a culture of sputum produced from the lungs, and then other respiratory secretions. They might do a blood gas analysis if they suspect pneumonia. If they suspect a urinary tract infection, they'll do a urinalysis. And then with wound and burn cultures, they'll take cultures from the infected area. And then if they suspect meningitis, they'll probably do a gram stain, and also a culture of cerebral spinal fluid. So diagnosis of this bacteria requires them to prepare a culture taken from the infection site. And that culture will usually be put on some type of media. So some common ones are blood agar, deoxycholate, citrate agar, or triple sugar iron agar. And then this bacteria, you'll usually see 3 different types of colonies. So if the sample is from soil or water, you'll see small rough colony. If it's from a clinical setting, you'll see more elevated, large, smooth colony with some flat edges. And then if the sample's from a respiratory tract infection or a urinary tract infection, it'll have sort of a slimy mucus-like appearance. So the bacteria will also produce this characteristic pigment that can be seen on the medium. So 2 of the common ones are pyocyanin, which is like a bluish green color, or pyoverdine, which is a yellowish green or kind of fluorescent color. And then less commonly, you might see pyorubin, which is a reddish brown color. And then I've just listed some tests that you can also do to help diagnose the bacteria as well. So as far as treatment goes, the gold standard is antibiotics. However, the specific type kind of depends on the location and severity of the infection. So they'll look at the results of the culture. With systemic infections, so infections that have spread throughout the body, they'll use parenteral therapy. So the medicine is administered intravenously or intramuscularly. And they'll either use single drug therapies, or they'll do a combination of different drugs. And then if it involves a multi-drug resistant strain of the bacteria, they've found that older antibiotics are a little bit more effective. However, the treatment options for the multi-drug resistant strains are definitely more limited, and they don't have as many effective drugs. With right-sided endocarditis, they'll do the antibiotic treatment, and then also they will remove whatever part of the heart valve is infected. And then for wounds that develop either pus or dead tissue, they'll perform surgical debridement, so clean out the wound and get rid of all that necrotic tissue. Unfortunately, it's becoming more and more difficult to treat this bacteria because there's an increase in its resistance to a large variety of antibiotics. So there's various mechanisms that this bacteria uses to resist antibiotics. So it will produce beta-lactamase enzymes that are resistant to beta-lactam antibiotics. They also have hyperexpression of the efflux system, so you'll see an efflux of the drug from the cell, so the drug being kind of pushed out of the cell. They also block the antibiotic from entering the cell, and then also they will synthesize penicillin binding proteins that have a low affinity for beta-lactam antibiotics. With this bacteria, these mechanisms can either exist simultaneously or as an isolated mechanism. So as far as prevention, the CDC recommends proper hand washing from everyone, workers, caregivers, even patients. So this means washing your hands for at least 20 seconds, washing in between fingers, under the fingernails. And then they emphasize washing your hands before touching a patient, before and after wound care especially, and then also after touching any sort of medical equipment. And then sanitizing the hospital room should be done daily, and then also any equipment that has been shared needs to be sanitized after each use. And then the CDC also recommends that healthcare facilities should have a water management plan to ensure water quality. So basically they just want to make sure that exposure to infection of various waterborne pathogens is minimized. Most healthy individuals are able to resist infection by this bacteria through innate immunity. So their natural killer cells coming in and killing the infected cells, and then also phagocytes ingesting any microbes that are released from the infected cell. Unfortunately, no vaccine currently exists against this pathogen. However, I read some promising new research that took place this year where they tested a live vaccine against the bacteria that causes pneumonia. So they used a mutated strain that lacks a key enzyme involved in the synthesis of D-glutamate. And this vaccine was applied through the nose of mice. And what they found was that the vaccine induced immunity in both local and distant body sites. And it also activated the immune cells, which were recruited into the airway mucosa. So they found that the immune response that was created actually allowed more mice to survive even after injection of two different strains of this bacteria that cause acute lung infection. So key takeaway is that there might be a promising vaccine out there against the strain of this bacteria that causes pneumonia. All right, and that is it. Thanks for listening.